to be affordable, the employee cannot pay more than $216 a month. Let's think about this. You're paying 50% of his coverage. The actual cost of his coverage in a month is roughly $500. How many employee-only options do you have on your groups now that are $500? In your community, remember we're community rated. So in your community groups, your 50-plus groups, how many employee-only premiums are roughly $500 with a $13 an hour employee? So it's something to look at. Now, an individual making $43,000, his premium can't be any more than $345 a month, roughly $700 employee-only premium. So you're thinking to yourself, when the renewal comes up, I'm going to have to do all this math. I'm going to have to help the individuals. I'm going to have to help the employers out, grade where each employee is. That's what the carriers are working on right now. The carriers know that this is a requirement. The carriers know that employers are going to have to meet this mandate. The carriers are already trying to work those numbers out in their head with their actuaries to make it easier on you. The carriers want you to buy their product. The carriers want the employers to offer their product to the employees. So they're going to do everything that they can to make it as easy as possible to these employers to make sure no one's left out in the cold and and there's no penalties out there.
This is confirming strictly pertaining to 50-plus employees.
Correct.
Okay.
Correct. Yeah, you could be a small group and you don't have to follow this 9.5% guideline. You don't even have to offer them coverage. So let's look at a couple of the penalties for large employers. I'm a large employer and I'm not offering coverage. And an eligible employee qualifies for a premium credit or cost share subsidy through the public federal exchange. This second part is the kicker. The second part is what gets the penalty. How's the penalty going to be collected? When you file your 2015 taxes. That's where the penalty will be collected. You're not going to get a knock on your door one day with the bill in the mail from the IRS. The IRS isn't going to come to your office and tell you to come up with this money. It'll show up when you file your taxes. And also, when an employer is eligible, and I'll show you in a little later, but when an employee is eligible for a cost share credit or subsidy, the employer is going to get an email or get a notice saying, hey, Lindsay Waters is your employee showing up on your W-2, and she just applied for a cost share subsidy or premium credit and has been approved. Why are you not offering her coverage? And you're going to have a 30-day window as an employer to come back and say why you're not, or say, oh, I didn't know. I completely forgot that she was eligible for benefits. Let me go take care of that now, Mr. Government. And you'll take care of it, you'll rectify it, no penalty to be had. So you will be notified when an employee triggers this before you're penalized and give you time to rectify.
And employee has 90 days to come on the plan.
Correct. Correct.
It's flat, 90 days, that's it.
Correct. And again, more guidelines about the 90 days will come out. So, not offering coverage, an employee gets premium credit or subsidy. I will be penalized as an employer $2,000 per full-time employee minus the first 30. I have 120 employees. 50 of them are part-time. I'm going to take those 50 out right away. Leaves me with 70. I'm going to minus the first 30 of my 70, and I'll be charged $2,000 times 40, my remaining employees. I will have a penalty of $80,000. I have 100 employees. 70 are part-time. That leaves me with 30 full-time minus the first 30. I have a $0 penalty. Alright, I'm an employer and I offer coverage, but it's not affordable and it's not adequate. It's not the bronze level plan. And an employee gets a premium credit or cost share subsidy. This time my penalty will be $3,000 per employee receiving the credit or subsidy. So it's possible only one of my employees it's not affordable to. What is
Credit.
credit? I'll fix that one of these days too. So it's possible only my plan isn't affordable to one employee, and one employee goes through the exchange and gets a credit or subsidy, and I'm just penalized for that one. So I've got 100 employees, 10 of them are receiving a premium credit or subsidy. I'm penalized $3,000. That's $30,000 on top of the premium that I'm already paying for the employees who are enrolled in the plan. Now, this is per month. If I go a month without providing coverage, and a month is considered one day. One day inside a month is a month without me offering coverage. So I can be penalized $30,000 divided by 12, and 1/12 of that would be my penalty for that month. And say in January I don't offer them coverage. Well, then I'm going to get penalized. The government calls me up. Now it's February 2nd. I hurry up and I get coverage because now I'm penalized for 2 months. Gets to August and I drop coverage. Government calls me up again because somebody's gone through the exchange. Now I'm being penalized again. So it's each month that you don't offer coverage, and it's based on, it's a per month, it's divided by 12.
So 30,000 is divided by 12.
Correct.
And so you get whatever.
Right, you would get, and for that month that you didn't offer coverage.
$2,500 a month.
Correct. Now, if you went all year, it would be the full 30,000. All right, a few points to consider. That's the meat and potatoes behind the law. Kind of what we're up against when we're talking to our employers, because what they're focused on is what do I have to do and what's going to happen if I don't do it. Well, there it is. Now, the other fun stuff. An individual says, well, my plan doesn't renew on January 1st. Or an employer says, my plan doesn't renew on January 1st. I just renewed in August. You mean I'm going to have to make all these changes again? No. HHS just released last week that regardless of when your plan renews, excuse me, let me back up. They released last week for regardless of your group size or whether you're an individual, you do not have to conform to these regulations until your plan renews. So that October 1 open enrollment date that everybody's up in arms about, you mean I'm going to have to go rewrite all my individuals, all my groups October 1st, and I've got to get it done by the end of the year? No. That open enrollment date is only for individuals who don't currently have coverage. Individuals who have coverage or groups that currently have coverage in place, you don't have to move them on to this new system until their renewal date. So we got our way because that's what we've had our fingers crossed, hoping that the administration would come out and say that we don't have to do this mass rollover or this mass change at the end of this year. So there is an open enrollment period, October 1st, 2013 through March 31st, 2014. During that period, anybody who does not have coverage has to enroll into a plan. If you enroll between October 1st and December 31st, you will get a January 1 effective date. If you enroll during January, you'll get a February effective date. If you enroll during February, you'll get a March effective date. If you enroll during March, you'll get a April effective date. If you have not done anything by April 1st, you cannot get into a health plan until the next open enrollment period, which will coincide with Medicare Advantage, October 15th through December 7th. So all these individuals who say, well, I'll just wait till I get in an accident and I'll call and enroll into a plan then. Or the agents who say, I'm going to set up shop in the emergency room and when people come in, I'm going to sign them up then. You can't do that. You've got to have a qualifying event in order to enroll into a plan off the enrollment period. Qualifying event has not been determined, but we're assuming it's going to be very similar to the way it is in the group market, meaning marriage, divorce, birth of a child, adoption of a child, loss of coverage. So if you lose your group coverage, you can jump into an individual plan. But you can't be out there without coverage and just jump onto the plan in August because now you want coverage. Also, it's rumored that there's going to be an additional penalty for every month that you don't enroll, similar to Medicare Part D. Employers with 50 or more full-time employee are only responsible for offering coverage to full-time employees and their dependents. Their dependent children under age 26. They do not have to offer coverage to their spouses. Employers can begin to say, look, Mark, love your spouse, but she's not going to be on the health plan. I don't know why they would say that, because it's no, if they don't have to pay for her or pay for the spouse, then what's the big deal? But the employers do not have to offer coverage for spouses. They do have to offer coverage to employees and their dependent children. They do not have to pay for dependent children, nor will the dependent children affect the affordability, but they have to allow the dependent children to enroll under the spouse, under the employee. Yes.
You mentioned something about spouse.
Mm-hmm.
Underwriting be effective probably similar to the way it is now. I guess I'm thinking about, you got a spouse that's 2 or 3 spouses that may have extreme health conditions.
But there's no health underwriting.
That's what I was,
Yeah.
okay. So
Yeah,
that's not gonna be an issue.
No, and I can't figure
Not
out.
like it is now.
Right. But what it does do is, say the spouse doesn't take the employee or the employer coverage, then the spouse can go through the exchange and get a credit or subsidy. Even if the plan's affordable, even if the plan meets minimum essential coverage, the spouse can still get the credit or subsidy. It doesn't penalize the employer. The employer doesn't get penalties, but the spouse gets to get that credit. How are HRAs going to be looked at? Integrated HRAs will be the only HRAs allowed. You cannot have a standalone HRA third party. The HRA component, the reimbursement component, must be integrated with the health plan. So if you currently have a high deductible plan and you're kind of using a back end HRA, that's not allowed. That's not going to be credible. That's not going to be a qualified plan. You have to have a true integrated HRA, similar to like Optima's HRA, where you have to use their third party administrator. Again, regulations for 90-day waiting period for new hires. And employer reporting regulations to the IRS. We're waiting on more direction in regards to the 90-day wait and the employer reporting. But there's going to have to be employer reporting to the IRS in order for the credits and the subsidies to all line up. How else is the IRS supposed to know if Lindsay Waters is employed with FNBC and if FNBC offers a health plan? All of that has to match up. So there will be some reporting requirements. We just don't know what yet or how that's going to be
bookkeeping
handled.
costs from the company for this.
Possible. Agent certification. There will be a certification. Agents will have to be certified and registered to sell on the exchange. Beginning roughly in June or July, we will see these portals open up. Similar to AHIP on your Medicare Advantage plans, you will go to the Anthem site or the whatever carrier site you wish to market their plans, and you will do a certification. Certification should last roughly 4 hours. You will be given, it looks like there are 27 modules you will have to go through. Once you go through those 27 modules, which will last roughly 4 hours, you will have a quiz. You will have a test to take. You will have to pass that test. Once you pass that test, all of your information, your agent data information, who you're appointed with, will be turned over to the to HHS, to the administration, to the exchange, and your name and contact information will then be put on the exchange website. So when Lindsay Waters, it's 2 a.m. and I'm looking to enroll in coverage and benefits, and this stuff is just getting too confusing, I need an agent. Well, based on my zip code, I will be able to pull down a drop-down box of all the agents in my area with their contact information, their website information, and their name, and from there I can choose which one I want to work with. So you will be, your information will be populated on the site, and individuals will be able to get to you even if you don't know the individual. Say I know Mark David and it's 2 a.m. and I'm on the site and I finish my application and they ask me, did an agent help assist you with this? I can type in Mark's name. Mark is certified. His name pops up. I can add him to my application, send it off. and Mark is listed as the broker